Assalamualaikum to Madam Nuraiza. My name is Erika from Bachelor of Nursing, Cohort 11. We'll be presenting my topic regarding online game addiction. First of all, I would like to give a brief introduction regarding my topic. According to the American Psychiatric Association, recognized online game addiction as a mental health concern in which with some individuals experiencing serious consequences ranging from the neglecting daily responsibility to struggling with social interaction and even physical health. As digital technology continues to evolve, so does the risk of excessive gaming habit turn into an addiction. Today, I will discuss the impact of online game addiction, the warning signs, and the steps we can take to promote a healthier gaming lifestyle. With this study, it shows a statistic of online gaming addiction in global. In Malaysia, 1.9% of adolescents are found to be addicted to online gaming. Comparatively, the rates are higher in Australia, 2.7%, Germany, 3.0%, and slightly lower in the Netherlands, 1.6%. These numbers are actually highlight that this is not just a local problem, but a worldwide concern affecting young people across different cultures. Another key finding is that male 2.66% are more likely to be addicted to online gaming compared to females 1.69%, are highlighting that these issues are more prevalent in young men. But the question here, what are the causes of online game addiction happen? There is several factors contribute to this growing issue. First of all, psychological factors such as the need for achievement and escapism. Escapism is referring to escape from a real-life stresses such as academic pressure, family problems, or social challenges. Many online games are designed with a reward such as leveling up, unlocking new content. So the player will be using a game as a way to help them escape from think or feel the stressor around them. Next one is social factor. This is including peer pressure and online community. Make the gaming more engaging. There may be a pressure to keep up with friends or other players, which can lead to more extended gaming session to stay competitive or to be part of the social. Besides that, the environmental aspects such as easy access to the game and high-speed internet also play a role in this online game addiction. For example, the easy availability of gaming devices such as smartphones, PCs, and consoles make it easier for individuals to play game at any time, which can contribute to prolonged gaming session. Moreover, emotional struggles and mental health issues like stress, anxiety, and depression can push individuals further into excessive gaming as a coping mechanism. Some individuals may use online gaming as a coping mechanism to deal with the feeling of loneliness, depression, or even anxiety. Video games can provide a temporary distraction from this negative emotion. Next, what can happen when gaming becomes an addiction? It can have a serious consequences on both physical health and mental well-being. First of all, we take a look on physical health effect. Sleep disturbance is one of the most highlighted in this issue because late night gaming can lead to irregular sleep patterns, causing fatigue and difficulty concentrating. Next, changes in appetite. Some individuals may skip meals, leading to poor nutrition, while others may engage in unhealthy snacking during playing the game. Sedentary lifestyle. Excessive gaming often leads to long hours of sitting, increasing the risk of obesity and related health issues. And then apart from that, it also can contribute to eye strains. Prolonged screen time can cause digital eye strain, headache, and even vision problem. On psychological and mental health effect, it also can help to increase the stress, anxiety, and depression. Excessive gaming can lead to elevate the stress level, anxiety, and even symptoms of depression. Impact on the relationship and social. There is many addicted gamers withdraw from the family and friends, leading to strained relationship and lack of realization. On social and academic, there will be most of the cases decreased academic performance because gaming addiction often lead to poor time management, missed assignment, and lower grades. Neglect of the responsibility also one of the consequences because excessive gaming can cause individuals to ignore the personal, school, or work-related duties. And then they will often have social withdrawal. Many addicted gamers lose interest in real-world activity, preferring virtual interaction over face-to-face relationship. These are the list of clinical signs or sign of symptom which individual who having online game addiction. First one, anxious or irritable when unable to play the game. Does not socialize with others. The next one is neglecting personal hygiene. And then using gaming to escape stress or problem. And then playing game to avoid negative feelings like guilt. And they tend to have sleep disturbance according to Cleveland Clinics 2022. Diagnosing gaming disorder involves carefully assessing behavior pattern and their impact on daily life. One of the first signs is a noticeable changes in the social interaction where individual may withdraw from family or friends, preferring virtual engagement over real-world relationship. They may become irritable, anxious, or restless when unable to play, and then displaying a mood swing and frustration. Another key factor is evaluate the educational and occupational performances. A decline in academic grades, missed assignment, poor concentration, or lost interest in work responsibility can indicate gaming addiction. Individuals may also neglect essential tasks such as procrastinate or struggle with time management due to excessive gaming. By identifying these warning signs, professionals can determine whether the gaming has become addictions that require any interventions. There is a few treatments treating gaming disorder involve a combination of psychological therapy, social support, and in some cases, medication. One of approaches include cognitive behavioral therapy (CBT). This therapy helps individuals recognize unhealthy gaming pattern, develop self-control, and replace compulsive gaming with healthier activity. It also addresses underlying issues like anxiety or depression. Next is a group therapy. Support groups provide a space for individuals struggling with gaming addiction to share their experience, learn coping strategy, and receive encouragement from others who are facing similar challenges. Next one is family counseling. Since gaming addiction affects relationships, family therapy helps to rebuild the communication, sets the boundary, and create a supportive environment that encourages a balanced lifestyle. Next one's medication only once if really necessary. In some cases, individuals who are struggling with severe anxiety, depression, or impulse control issue may benefit from the medication prescribed by the healthcare professional to manage the underlying condition. Therefore, a combination of these treatments tailored to the individual needs can help to regain their control over gaming habits and restore a healthy balance between digital and real-life activity. Okay, now let's move on to nursing care plan. The main highlighted nursing diagnosis, the first one is sleep disturbance related to excessive screen time and gaming habit. The second one is self-care deficit related to impact time management and neglect of personal hygiene. And then the third one is social withdrawal related to excessive focus on online gaming and reduced interaction with family and peers. And then the fourth one is this of impact academic or occupational performance related to neglect of responsibility due to excessive gaming. The fifth one is knowledge deficit related to effect of online gaming on physical health and well-being. So for the first nursing diagnosis, there is a few interventions can be done. First one, assess sleeping pattern of the patient. Assessing the patient's current sleeping habit is crucial in identifying sleep disturbance or pattern that might contributing to poor sleep. This helps to develop a personalized care plan and track any changes over time. Second one, establish a sleep routine for patient. A consistent sleep routine helps to signal the body when it's time to sleep, aiding in better sleep quality and duration. Routine can enhance circadian rhythm regulation, making it easier to the patient to fall asleep. The third one, encourage proper hygiene prior to sleep on patient, because proper hygiene including activity like brushing teeth, taking a bath, wearing a comfortable sleepwear can signal the body that it's time to sleep. This habit create a sleep conducive environment and improve a sleep quality. The fourth one, limit the gaming time, such as alarm or reminder. Gaming, especially before bedtime, can increase alertness and disrupt the body ability to sleep. By setting a reminder or alarm to stop the gaming is a benefit before the sleep. The patient can avoid overstimulation and promote relaxation before the bed. The fifth one is teach relaxation techniques such as deep breathing exercise or meditation. Relaxation technique like this, deep breathing exercise and meditation, help reduce the stress response and calm the nervous system. This will encourage a state of relaxation which is vital for initiate and maintain a good sleep, a quality sleeps. The next one is educate on psychological effect of gaming to patient for awareness, because education on psychological impact of gaming such as overstimulation, addiction and disrupt sleeps help the patient to be informed about their decision, about their behavior. Therefore, the awareness may encourage them to adjust their gaming habit for better mental health and sleeps. The next one is encourage physical activity on patients such as jogging, brisk walk or cycling. This regular physical activity helps reduce anxiety, improve the moods and regulate sleep patterns. It encourages physical tidiness, making it easier to fall asleep and sleep more even better. However, physical activity should be done earlier in the day, not too close before the bedtime. Then the next one is evaluate the initial and current status of the patient. Regular evaluation helps to determine whether the intervention are working. Comparing the patient initial and current status provide insight into the effectiveness of the care plan and any adjustment is needed. Lastly, documentation as evidence of care given appropriately, because accurate and thorough documentation ensures that continuity of the care provide the evidence that intervention is carried out appropriately. This help in monitoring progress, assessing in effectiveness of the care plan. Proper documentation is very important for legal and clinical purposes. Next one, for the second nursing diagnosis, this is the list of intervention can be done. First one, assess general condition of patient. Assessing the patient general condition helps in understanding their physical and mental state. This including evaluating their mobility, cognitive function, emotional well-being, and any physical limitation. It forms a basis for planning appropriate care and intervention for the nurses. Second one, encourage and remind the patient to bath and change clothes to be presentable. Rational, because this will encourage proper hygiene and ensuring that a patient changes into a clean, presentable clothes, help maintain physical health, contribute to a self-esteem. Proper grooming is important not only for health but also for social interaction and mental well-being. Reminders can help a patient may forget or lack of motivation to take care for themselves. The third one is ensure that safety environment for patient to take bath. This is because ensuring a safe bathing environment is essential to prevent falls or accident, especially in elderly persons. Installing a grab bars, ensuring the floor is dry, and making sure there are no obstacles in the bathroom are the key to reducing risk and promoting independence in personal hygiene. The fourth one is praise the patient when they are able to perform personal hygiene. This will create positive reinforcement, helps to build the patient confidence and encourage them to maintain their personal hygiene. Praise promote a sense of achievement and increase motivation to engage in self-care activity. The fifth one is evaluate initial and current condition of the patient. Evaluating the patient's progress over time provide insight into the effectiveness of the intervention, and then helps the nurse to identify any area to be improved or further assistance needed, allowing for adjustment in care plan to meet the patient's needs. And then the last one is documentation. As evident care is given appropriately, accurate documentation ensures that all activity are recorded and can be references if needed. It provides a clear record of patient's progress, ensures accountability, allowing for continuous and comprehensive care approach. Documentation also help in to support the legal and clinical standards. Apart from that, I would like to highlight this part of the presentation related to prevention to online game addiction. What can be done, such as setting time limit. This will help to control gaming time, ensuring balance with studies, works, and social activities. Next one, encouraging alternative activities, such as promotes hobbies, sport, or outdoor fun to reduce reliance on gaming. The next one, parental guidance and monitoring. Parent needs to set a boundaries and educate the kids on responsible gaming. And then the next one is promoting social interaction. Encourage the real-life friendship and family bonding instead of isolation. And then the last one, the most important one is education and awareness. School and community can teach the risk of excessive gaming and healthy habit about the gaming. We almost come to our end. To conclude my presentation for today, online gaming addiction is a growing issue that affects physical, emotional, and social well-being. Excessive gaming can cause sleep problems, neglect of self-care, social isolation, and poor performance in school or either works. Over time, it can lead to health issues, strained relationship, and lower quality of life. Early intervention, education, time management, and supports are essential for overcoming addiction and maintaining a healthy balance. So that's all for my presentation for today. Thank you, madam. This is my references.